Prosthodontics, 2nd year, Lecture 2. Anatomical Landmarks of the Maxillary Arch. Objectives: to give knowledge about the intraoral anatomical landmarks, denture bearing areas and denture boundaries. To fabricate a complete denture, retention, support, stability with preservation of these underlying and surrounding structure. To deliver a denture which is compatible with the oral environment, able to function in harmony during mastication, speech, and swallowing. Understanding the maxillary and mandibular intraoral landmarks will aid the clinician in carefully managing a patient and serve as helpful indicators of the impression and denture's limits. Extensions: maxillary arch anatomical landmarks divided into A. Supporting structures. B. Limiting structures. C. Relief areas. A. Supporting structures. 1. Residual alveolar ridge. 2. Maxillary tuberosity. 3. Incisive papilla. 4. Rugae area. 5. Median palatal ragi. 6. Canine eminence. 7. Zygomatic process. 8. Torus palatinus. 1. Residual alveolar ridge. The bony process that remain after teeth have been lost is known as residual alveolar ridge, which is covered by mucous membrane. The residual alveolar ridge considered to be as a primary stress-bearing area, and it will produce the ridge fossa or groove in the impression or denture. Types of residual alveolar ridge: A. Flat. B. Rounded. C. V-shape. D. U-shape. 2. Maxillary tuberosity. It is the area of the alveolar ridge that extends distally from the second molar to the hamular notch. In some cases it may be very large in size and not allow for proper placement of the denture, so may need surgical interferences. Maxillary tuberosity may be oversized, resorbed or undercut areas. In case of oversized and undercut type, surgical corrections may be needed. 3. Incisive papilla. It is a pad of connective tissues lies between the two central incisors on the palatal side overlying the incisive foramen of the nasopalatine duct, where the nasopalatine nerves and vessels arise. In an edentulous mouth, it may lies close to the crest of the residual ridge. Relief over the incisive papilla should be provided in the denture to avoid pressure on the nerve and blood supply. 4. Rugae area. These are raised areas of dense connective tissue in the anterior 1/3 of the palate. It aid in the formation of vocal sound, also regarded as a secondary stress-bearing area. 5. Median palatal ragi. It overlays the medial palatal suture, extend from the incisive papilla to the distal end of the hard palate. The mucosa over this areas is usually tightly attached and thin, the underlying bony union being very dense and often raised. The palatal tori are located here if present. 6. Canine eminence. It is a round elevation in the corner of the mouth. It represents the location of the root of the canine, which is helpful to be used as a guide for the arrangement of maxillary anterior teeth. 7. Zygomatic process. It is located opposite to the first molar region, hard area found in the mouth that has been edentulous for long time. Relief over this area may be required to prevent soreness of the underlying tissues. 7. Torus palatinus. It is a hard bony enlargement, occurs in the midline of the roof of the mouth, hard palate. It is found in 20% of some patient. Surgical correction may be needed if the tori very large. B. Limiting structures. 1. Labial frenum. 2. Buccal frenum. 3. Labial vestibule. 4. Buccal vestibule. 5. Fovea palatini. 6. Posterior palatal seal area, vibrating line. 7. Hamular notches. 1. Labial frenum. It is a fold of mucous membrane extends from the mucosal lining of upper lip to the labial surface of the residual ridge. The frenum may be single or multiple, narrow or broad. It contains no muscle fibers and insert in a vertical direction, which creates a maxillary labial notch in the maxillary impression or denture. 2. Buccal frenum. A fold or folds of mucous membrane. Varies in size and shapes. It extends From the buccal mucous membrane. Reflection area toward the slope or crest of the residual alveolar ridge. It contains no muscle fibers in its direction antero-posteriorly. It produces the maxillary buccal notch in the maxillary impression or denture, which must be broad enough because of the movement of the frenum, which is affected by some of the facial muscles as the orbicularis muscle pull it forward while buccinator muscle pull it backward. 3. Labial vestibule. It extends on both sides of the labial frenum to the buccal frenum, bounded by the upper lip and residual alveolar ridge. The reflection of the mucous membrane superiorly determines the height of the vestibule. It contains no muscle fibers in the denture. The area that fills this space is known as labial flange. 4. Buccal vestibule is the space distal to the buccal frenum. It is bounded laterally by the cheek and medially by the residual alveolar ridge. The area of the denture which will fill this space is known as buccal flange. The stability and retention of a denture are greater enhanced if the vestibule space properly filled with the flange distally. 5. Fovea palatini. These are two indentations on each side of the midline formed by a coalescence of several mucous gland ducts. They act as a guide in the location of the vibrating line of the posterior border of the denture. 6. Posterior palatal seal area, vibrating line. An imaginary line drawn across the palate extended from one hamular notch to the other. It is not well defined as a line, therefore it is better to describe it as an area rather than a line. The direction of the line varies according to the shape of the palate in the denture. The posterior border of the denture known as posterior palatal seal area. 8. Hamular notch. It is a narrow cleft of loose connective tissue situated between the maxillary tuberosity and the pterygoid hamulus, approximately 2 mm antero-posteriorly. It is used as boundary of the posterior border of maxillary denture. See relief areas. 1. Incisive papilla. 2. Mid-palatine raphe. 3. Torus palatinus. 4. Cuspid eminence. 5. Zygomatic process. Anatomical landmarks of the maxillary arch.